in Placket, and today is Thursday, August 20th. Greetings to all residents, to all staff, to all guests. As you can tell, the background is different. The location is different, and the reason is because the Lee Chapel in Episcopal Church Home, it is part of the expanded COVID unit. And I'll get to that in just a moment. And so we're not able to be in that space. So moving forward, we'll eventually get back there, I'm sure, but for the time being, I'm not able to be there. Love that Lee Chapel, though. So it's certainly very sobering to report that we have 32 cases at Episcopal homes. This is the highest number of individuals that we've had with active COVID cases since the virus entered the United States, since it entered Episcopal homes. So we have 32 total cases, 16 are residents and 16 are staff. And the residents, one lives at King's Crossing, one lives at Carty Heights, and the remainder are at Episcopal Church Home. Also the one of the residents from Episcopal Church Home, they spent a few days in the hospital, and last night they did pass away. And we're certainly very saddened by that. We pray for them. Yet, as we know, COVID is that serious. The range of symptoms is, as you have heard and read about over these last 6 months, they range all the way from no symptoms at all, because some of these residents and some of these staff, they have no symptoms. They were only tested because it's part of the full organization-wide testing that we're doing at Episcopal Church Home. And so the positive cases revealed themselves when the test results came back. But otherwise, some have no symptoms at all. And then, of course, others, as I just said, one resident died at the hospital after being put on a ventilator. So there's the full range. And the staff, of course, they are all at home in the process or at some stage of recovery. So last week, we had 8 positive cases at Episcopal homes, 1 resident and 7 staff. 1 week later, we have 32. It shows how contagious this virus is. It shows also how we become increasingly vulnerable as society opens up more, as more visitors are allowed, as people are coming to and fro in terms of their activities, staff interacting with their children who are involved in a variety of potential things. And so this dramatic increase from 8 to 32 is not only very sobering, it's also educational, just showing that we can never become complacent. We can never assume that it's not going to affect us, because it has in a very serious way. Testing and retesting is occurring yet this week and next week at both the Gardens and at Episcopal Church Home. At the Gardens, all the testing that they had done last week, almost all or all of the results are back, and they all came back negative except for a couple of staff. But otherwise, all the residents came back negative. Nevertheless, they still are going to do additional testing. Let's see, so it's Thursday, I think it's next week, both Episcopal Church Home and the Gardens, where the testing will be renewed. Let's see. So that's, for the most part, it. And that is, in summary, it just shows how vigilant we all have to be. The best protection that we have is wearing a mask at all times and staying 6 feet apart. If we have any symptoms, self-isolate and get tested, and then frequent hand washing. Those are our best tools that we have. We all need to do it for not only your health, but also your neighbor's health, your loved one's health. It's this dramatic increase here. It just affirms and confirms what we've known all along, that it is contagious, that it is serious, and that we don't know whether or not we have it. You don't know whether or not you have it right now for sure. I don't know for sure whether or not I have it, because some people are symptom-free. That's why, again, it's so important that we employ those techniques to protect ourselves and protect one another. Take care, everyone. Wish you well. I will be back on Monday at 1:30. Bye-bye.